For healthcare coverage for 2026, the open enrollment deadline is just under 2 weeks away. At this hour, there's still no decision from Congress on the Affordable Health Care Act, which triggered the federal government shutdown back in October. Our Bralise Pimentel spoke with insurance and medical experts about coverage, and Bralise, they say families are concerned.
Friendy, local insurance companies tell me families have been calling them anxious as the deadline for open enrollment gets closer. They say without an act from Congress, families in the Midlands and across the state will suffer from the impact.
In the system that we're looking at now, where we're potentially going to have, as you know, more people who don't have access, the system that's going to see the biggest impact of this loss will be hospital systems, where more and more people are going to now relegate their health care to the ER because they don't have access to anything else.
Dr. Bambi Gaddis, a public health consultant, speaking out with concerns about the looming open enrollment deadline. Gaddis says this state is already facing health care issues due to limited providers and health care premiums increasing. She says these issues are forcing families to go without coverage.
We're appealing to the community to get back engaged, because what happens when we don't, we see the loss and continued loss of vital systems that we have to literally survive.
Gaddis says people should do their homework on who they vote for and represents them. Last month, Democrats and Republicans voted to put the Affordable Care Act to the side to reopen the government. Insurance experts say without extending the health care tax credit, premiums will double.
We're hearing people all the time discuss, can I afford insurance? Or maybe I only insure certain members of my family. One of our agents told me a story about a husband and wife who were debating which one of them were going to get insurance because they both couldn't afford it. And I just think we can do so much better.
Joel Laurie, the president and CEO of Laurie Life and Health, says people that are used to paying $200 to $300 a month could start paying $1,000 a month. He says members of the Senate and Congress need to take action before hospitals and businesses feel the impact.
The number one reason that people go into bankruptcy is medical debt. And that's what we hope to avoid, and that's what really scares me the most for people around this state moving forward, is if we see 100 or 150,000 people lose their health insurance, that's fine until it's not. That's fine until they need to go into the hospital or need to go to the doctor, and then they've got a significant problem, and that's where people get sick, people go into debt, people lose their jobs. The catastrophic circumstances that just multiply in those cases is very concerning.
Joel Laurie says that everyone should have at least some health coverage to avoid medical debt. He encourages people to connect with a trusted agent until Congress comes to a decision. The last day to enroll for personal coverage is Monday, December 15th. In studio, I'm Bralise Pimentel, Watch Fox News, Local First.